Welcome everyone. We'll get started in a couple minutes here. Hi everyone, welcome to the virtual open house for Campus Health and Wellbeing. My name is Lauren McMichael and I am very excited to get you acquainted with the Health Center. I will be your host today. A little bit about me, I am a fourth-year nutrition major. I've been involved with the Health Center for just over 2 years now. I work in peer health education and I am also the president of the Student Health Advisory Committee. This committee works to make sure that the services and supports that Campus Health and Education put out meet the needs of the students. I have had the privilege of working with an incredible staff here at the Health Center and I can't wait for you to meet them. So a little bit of logistics of how this is going to go. So I will introduce you to the faces of the various different service areas at Campus Health and Wellbeing. They will introduce their area and talk to you about the services that they provide. And then at the end, we will have a Q&A session. So first, I'd like to introduce you to our first speaker. Her name is Tina Hataway Mellis, and she is the Assistant Vice President of Student Affairs for Health and Wellbeing.
Hello, as Lauren said, my name is Tina Hataway Mellis, and I am the Assistant Vice President for Student Affairs, Campus Health and Wellbeing. I've had the privilege of leading this amazing team here at Cal Poly for the last couple of years. And before we move forward in the presentation, I wanted to congratulate all of you. I told folks earlier, I felt like a newscaster sitting behind this desk. And so the old news is you did it. You were accepted and you made it here. So congratulations, huge. Congratulations to your supporters, your family members, and your loved ones that have helped guide you to this point, and a huge congratulations for you for getting it done. Over the past couple of months, our world has been presented with some unprecedented public health challenges, and I want to acknowledge the challenges that's presented for all of you as possible, graduates, seniors, transfers. I also want to acknowledge that some in the audience might have already been affected by COVID-19 and just offer support and comfort during this time. One of the things I wanted to share, and I got some notes, so I just want to make sure that you all know that one of the things that we've done in response to COVID-19 here at Campus Health and Wellbeing is really been a group effort. We have had wonderful connections and relationships and partnerships with San Luis Obispo County Public Health. We're on first name basis with them. We have them in our cell phones. Our medical director, Dr. Aaron Baker, is frequently in contact and has been throughout all of this. And while it's changed the landscape of our lives and brought about a not so new normal, I continue to be amazed at the resilience of the Mustang family. When I think about the global response to COVID-19, I can't help but think about our learn by doing philosophy. The fact that so many engineers, computer scientists, public policy makers, all of you in the audience that are thinking about going down these career paths, all of the ways that those professionals and all of the essential workers have been impacting our society. And I really welcome and challenge all of you in your journey through Cal Poly to become the policymakers and the world changers during your time here. So as Lauren shared earlier, over the next half hour or so, you're going to hear from a small sample of our impactful but amazing team. From health education, prevention, well-being, our medical services, mental health services, all the professionals that make up the Campus Health and Wellbeing team will guide you through a variety of services and support that we offer. This group is dedicated, they're brilliant, they're here to empower you, support your health, your well-being, and of course, your academic success. So enjoy the rest of this presentation and the list of comprehensive services that we offer. There are moderators in the chat rooms that are going to be answering questions. I'll be in there as well if there are any questions that you'd like to direct specifically to me. And once again, welcome to Cal Poly, and we can't wait to actually meet you. Take care.
Thank you, Tina. Next, I would like to introduce you to Jeannie Kim, who is the Director of Wellbeing Services.
Hi everyone, my name is Jeannie Kim. I use she, her pronouns. I'm the Director of Wellbeing here at Campus Health and Wellbeing. Fun fact, I'm also a Cal Poly graduate in the Master's in Public Policy program. And I recently completed my doctorate in social work thinking about macro systems change and how we can help create a better world. So I am here to tell you a lot about our amazing services within Wellbeing. As Tina mentioned, a lot of the work that we do here at Cal Poly is of prevention nature, and what our main mission is to help support the health and well-being of our students so that they can be successful and thrive here at Cal Poly. And part of that is through amazing health educators that are on this call helping to answer questions for you all, but through proactive prevention, education, and outreach services, including public health campaigns, messaging, as well as our food pantry that provides direct service for students who are in need. And then one of our prize points is our Learn by Doing opportunity of peer health education programs. It's a suite of peer wellness programs that have wellness ambassadors, peer health educators, as well as peer coaches that help support our Mustang family to be successful and to do well here at Cal Poly. Included in that is our crisis advocacy services and SAFER, and our gender and power-based violence programs to help support students who are experiencing acts of gender and power-based violence. And so I think some of the most amazing things that we do is work collaboratively with our medical providers as well as our counseling staff to get the message out to our students of how to access services and how to thrive here at Cal Poly. So welcome to the Mustang family, and we're excited to have you join us.
Thank you, Jeannie. Next, I would like to introduce you to a staff member of SAFER. SAFER is Cal Poly's confidential advocacy, education, and support for sexual misconduct, sexual assault, dating violence, and stalking. I'd like to introduce you to Jennifer McMartin, who is the prevention specialist for gender-based violence initiatives.
Hi, everyone. So thank you so much for the introduction, Lauren. My name is Jennifer McMartin. I use she, her pronouns, and I am the prevention specialist for gender-based violence initiatives at SAFER within Campus Health and Wellbeing. Similar to Jeannie, I also graduated from Cal Poly in 2017 with a sociology undergraduate degree. So a little bit about SAFER and what we offer. We are Cal Poly's primary resource for addressing all forms of gender and power-based violence, including sexual assault, intimate partner violence, stalking, harassment, etc. We have two branches of our services. So we have advocacy for survivors as well as their loved ones, and for the entire campus community, and that includes students, staff, and faculty. The entire campus community will touch base with our programming at some point. We have touch points with students during slow days, during our week of welcome orientation series, and throughout the school year. We are eager to engage with all of you to continue to foster a welcoming, inclusive campus community for everyone. We encourage everyone, students and families alike, to engage in these conversations around expectations of sex and relationships before coming to college, but we are available on site if anything does come up for you. All of our professional staff members are certified through the state of California as peer crisis counselors for sexual assault and domestic violence. So within the scope of our advocacy services, we meet with our clients one-on-one and confidentially, and we're able to provide crisis intervention, peer counseling, accompaniments to medical exams or law enforcement interviews, Title IX proceedings, and as well as make warm referrals for any housing, basic needs, therapy, etc. On the flip side, and kind of what my wheelhouse is that we offer prevention education for the entire campus community. So we outreach to our campus to prevent this violence from ever happening in the first place, right? We have a team of student leaders who develop peer-led curriculum for the entire campus and hold broad-reaching awareness months and social media campaigns in order to set healthy social norms for the campus. All of these services are available virtually right now and will continue to be, and are developed to meet the needs of the community. There are plenty of ways to get involved as a student. We offer quarterly trainings that serve as a prerequisite to volunteering or interning with our program. And we also have many satellite groups based on campus affiliation that help to inform our peer curriculum. So students involved in athletics or students involved in Greek life will have an ample opportunity to become leaders in this movement against gender and power-based violence and shape trainings to their peers. We also hold 3 month-long awareness events in Domestic Violence Awareness Month, Stalking Awareness Month, and Sexual Assault Awareness Month, coinciding with the national movements on these topics. These aim to engage our entire campus community to build greater empathy, to strengthen our understanding of these topics, and cultivate a violence-free environment. Our students are heavily involved in our programming and develop the bulk of our outreach to our community. One of our prevention education interns that I have the pleasure of working with, Sarandon, is actually hosting her own virtual open house session about engaging in violence prevention as a student. She's a third-year political science major who's been working with SAFER in some form since her freshman year. Her session will be held on Friday, April 24th at noon, and I highly encourage you to attend that. Thank you all so much. Congratulations for coming to Cal Poly, and I appreciate you all being here. Excited to engage with you further.
Thank you, Jennifer. Next, I would like to introduce you to Dr. Michael Corrigan, a physician from Medical Services.
Hey, everybody. I'm Dr. Michael Corrigan. I am a primary care sports medicine specialist here on campus. I have the privilege of working both here at Campus Health and Wellbeing and with athletics. And I'm here today to tell you a little bit about the medical services that we offer here at Campus Health and Wellbeing. First, I always like to kind of tease my students and my parents who ask these questions. I remember when I was in college, I always wondered if the doctors who worked on our campus health were real doctors, like, are they really doctors? And I assure you that the doctors and the clinicians we have working here at Campus Health Wellbeing are all board certified, all fully licensed. Some of us are boarded in more than one specialty. And I'd like to add that college health in general is oftentimes an unrecognized specialty within the medical services that really attracts a special kind of clinician and a special kind of person that cares deeply about taking care of college students. It's a difficult time. You're coming into school. Oftentimes, parents have helped you with your medical care throughout your life, and suddenly you're on your own. And our clinicians here, our nurses, our doctors, our physician's assistants, our nurse practitioners, our clericals, they're all very dedicated to helping everyone with that transition. A little bit about our services here. It's a large building that has the different areas that you've already heard about in the building. In the medical services, we offer primary care and urgent care here for patients both on an appointments basis as well as a walk-in basis. This is provided by physicians, physician's assistants, nurse practitioners, and nurses. We also offer services in reproductive health. That's a very common and busy practice here. We have my area of specialty, sports medicine, and we have our full, with that, we also have a full radiology suite here. We have nursing care who can help patients who contact us with questions or people who walk in. I'm not quite sure if they need to see a clinician or not. The nurses are very active with that. We have new this year, gender affirming care, which is also a special area that's picking up a lot of steam and is very important. We have in-house psychiatry with our own psychiatrist who works right here at Campus Health and Wellbeing. We have a registered dietitian for nutrition services here on campus. So it's a relatively well-rounded, robust practice. To support our services to the students, we have our own in-house laboratory. We have our own in-house pharmacy. And as I mentioned previously, when I talked about sports medicine, we have our own in-house radiology suite. The pharmacy here serves our students and oftentimes will provide prescriptions at very reasonable cost. So it is a good service that we have for our students. Very oftentimes much cheaper than our local services. Finally, we also have a travel clinic here. A lot of our students travel abroad during the school year, and we have services to help them prepare for that service or for that travel. And that's, again, a very robust and active service. The time, a lot of students when they get to campus want to know when we're open and how to access us. We are open from 8 to 5, Monday through Friday, with the exception of Wednesdays. We open at 9 because for staff meetings during 8 to 9 hour. When we're closed, we always have nursing services available. If you call our main number, you'll be connected to nurses who will help you, help guide you with your concerns, and will give you advice as to either self-treatment or going to the emergency room, or they'll help you decide what to do. We also have very reliable local urgent care centers here in San Luis Obispo, as well as local emergency rooms for issues that arise either after hours or are much more serious that we can't handle here at the service. And we have a very collaborative working relationship with our local services. A lot of students and parents especially are always interested in learning about health insurance. We do not take health insurance here in our office. All services are either covered under the health service fee. There are some exceptions to that for orthopedic care like splints, casting, or not, I'm sorry, not casting, but crutches. But for most services, things are covered under the health service fee. I personally recommend to families that students are covered under some type of health insurance, in order, are we still going? Okay. In order to cover expenses that are incurred for emergency care. I always give examples to my parents, such as appendicitis or something like that, where you would be hospitalized. And so it's good to know what your insurance covers and what it doesn't cover here in San Luis Obispo County. And we do have people here who can help figure that out if you need it. One thing that is also on parents' minds when I talk to them is how do they get information about their students? I always remind people, both students and parents, that once a student is 18 years old or older, it is federally mandated that their health information is private. We are not allowed to speak to anybody about their health care here at College Health and Wellness without the student's permission. Now, having said that, I can tell you that a lot of students want their parents to know what's going on. A lot of parents want to know what's going on. So we make it quite easy for them, and they can sign a waiver that will let us know when we can discuss their healthcare with parents. That is available. That form is available on our website. And if you have any questions about that, you can always give us a call as well. The last thing I really want to discuss, and this is new for us this year and all the CSU schools, is it is now mandatory to update immunizations and tuberculosis screening before arriving on campus. We have gone through and made recommendations on the different types of immunizations that are required. Some are recommended, some are required. And I think probably that website is being flashed on your screen. And if not, it is on our website again, that you can take a look at that. I recommend getting started on that earlier rather than later, because some immunizations can take up to 6 months to complete the series. So please take a look at that. It is important that you arrive on campus with your immunizations up to date, and that we at Campus Health and Wellbeing have a copy of that so we know what's going on. The last thing I want to say is congratulations, whether you've already been accepted here or you're just thinking seriously about coming. It's a great school, and students here are very happy, and I think that for the most part, we help our students maintain success while they're here, and I'm very proud of that. Thank you so much.
Thanks, Dr. Corrigan. The next person I'd like to introduce you to is Dr. Shayla Cole from Counseling Services.
Hi, everyone. I'm Dr. Shayla Cole. I work at Cal Poly Counseling Services, and I just want to take a moment to give you some information about us. So we're a diverse staff with approximately 20 clinicians, including psychologists, family and marriage therapists, and clinical social workers. So most importantly, for all of you who are on a student budget, all of our services are free for students. So yay! Another thing that's important to note is, like medical, all of our services are confidential. So meaning we're never going to release information without your consent, unless you are a risk to yourself or other people, or if you tell us information about a protected population, such as minors being abused. So basically, if a professor calls in, your parents call in asking for your info, all we're going to say is we can neither confirm or deny that so-and-so has even been seen here. A little bit more about our services is, so many people have the idea that counseling is when you come in, lay on a couch and tell us about your dreams. That's not quite what we do. What typically happens is you schedule an initial consultation with your therapist. You fill out some info about yourself, and you just have a conversation with your therapist. Then your therapist then creates a plan for you, given your unique needs. So this plan can include some of the services that we offer, including individual sessions, workshops, couples work, or even group services. Sometimes that may also mean sending you to other resources on campus. Maybe we'll have to send you to one of my colleagues who spoke earlier that may be best fitting for your needs. Or it may be something such as the DRC or Mustang Success Center. So we work with all sorts of concerns. So for example, anxiety, depression are common ones, social isolation, substance use, family concerns, and just kind of overall adjustment to college. It's a really difficult transition, you know, coming from being at home, having your parents there, having your set friends, kind of that schedule. Okay, I go wake up at this time. I, you know, have the set schedule of these classes I go to. It's a huge shift in terms of development. And so we're there for you in terms of just general adjustment needs, and then kind of just really anything that you can think of. And so we really want to emphasize that we work holistically, meaning we want you to be healthy physically, mentally, and socially, and just to overall succeed here as a student. So you may be wondering how to get connected with us. So all you have to do is pick up that phone. I know we're using it a lot nowadays for various things. So pick up that phone, give us a call, you can dial our number to schedule that initial appointment. Sorry, reading the questions as they come along. So I'm answering that one question of how do you schedule initial appointments. The best thing to do is just call. Also, we like to be flexible, so we understand, things happen, crises happen. So if you're a student and you're experiencing a crisis, please don't hesitate to reach out to us in Campus Health and Wellbeing in Building 27, or again, just call. If you don't know what to do, confused, please just reach out via phone is really the best way to get in contact with us. More information, if you're looking for some more details, you can go to our website, which is at counseling.calpoly.edu. It gives you some more details about the services that we offer. We have like a group list on there that you can look at. Also, just more information about how to get connected with us if you have any questions. And I want to open it up to any other questions that people may have. All right. I'm not seeing anything pop up, but if you do have all right. So I just received a question. Do we offer discussion groups for the first quarter to assist with college adjustment? So right now we don't have a specific group geared towards college adjustment specifically. I think that's been in the talk among some of the clinicians because we've really identified that as a need for students. And so I think likely in the future that is something that is going to happen. And if you have any questions about that, when you come to campus, how to get connected with group is first you have to make that initial, jump, give us a phone call, meet with a therapist, and they can really give you the nuances of what is going to be best for you and refer you to that group if it's going to be a good fit for you. Those are all the questions that I'm seeing pop up.
Thank you, Dr. Cole. We will now transition into a time of Q&A for all of our panelists. So please utilize the chat to ask any questions that you have.
Hey everyone, I wanted to respond to a question that popped up in the chat regarding self-defense classes. Someone was asking if we offer that on campus. And so I wanted to talk about what we offer. We do not currently offer self-defense classes through our programming. And that's for a couple of reasons. We know that in a moment of crisis, most often these trainings do not come to the forefront of our brain if it's something that we've only been taught in that one moment. And also a vast majority of assaults we know occur between people that know each other, between roommates and friends and classmates and other acquaintances. It's very rare for assaults to be committed by a complete stranger. So that's usually what those self-defense classes are sort of geared towards, and we want to move away from that narrative. Our program also operates on a primary prevention model with the idea that violence shouldn't have to happen in the first place and that we can prevent it from ever cultivating that culture. We also try to reinforce that it's never the victim or survivor's responsibility for preventing harm happening to themselves. So rather, we engage the entire campus community to build empathy and community with one another and follow guidelines from the CDC regarding violence prevention through a public health lens. Thank you so much for asking that question. I know that's really valuable, and we're all geared toward keeping the students safe and keeping our community safe, and we engage in a lot of different ways to do that.
I want to answer a question that popped up from somebody asking if mental health services were time limited. And I just wanted to say that we don't have a limit on the number of sessions that you receive. It's more so an agreement between you and your therapist of what is going to be best for you. whether that is, a few individual sessions, and if it is something that's maybe something more long-term, so you're looking for something that's, going to be, 2 times a week, for the full 4 years that you're here, we may talk about finding other services for you out in the community. But we always help with getting people connected if they're asking for a higher need or need a higher level of care. Thank you. That's a good question.
Hi, the question about the use of private insurance has come up quite a bit in the chat room, so I thought I would address that live. We do not accept private insurance. We're fully funded by the health fee dollars that come in. And so the use of private insurance is really for the community. So you would use your insurance if you had to go to CVS to pick up your prescription, but the prices at the pharmacy here are really reasonable. Our over-the-counter prices are really, really reasonable. So I'd encourage you all to make a phone call or send a message to find out, what the cost might be at the community pharmacies, and see if we would be able to fill that here for you. So private health insurance would be used if you went out to a community doctor or if you had to go to the emergency room or things like that. That's a question about immunization requirements. They are still required.
Conscientious objections.
Yes, so the CSU policy executive order that was written for the immunization revisions does not allow for exemptions other than medical exemptions. So that would be allergies or pre-existing conditions that would prevent someone from getting a immunization. There is one person that asked a couple of questions about rules related to COVID. Will students be required to wear masks? Will they be required to physically distance themselves? There's nothing that's been discussed at the moment that would be a requirement. We want to tread very carefully in how things are worded. Public health can mandate a lot of things like our shelter at home. But the advisement from the CDC is cloth-based coverings. That's going to keep others safe from your droplets. So while it may not be a hard and fast rule or be an absolute mandate, we are going to encourage it. We're going to work with our peer health educators and have them spread that word because we want that word spread and not germs. So if you have access to a face cloth or face covering, it doesn't have to be a mask like you see on the doctor's shows and things like that are on the news right now. It could be a bandana, it can be something homemade, a scarf, but we would really encourage all of our students to be practicing good public health prevention strategies.
You see any questions right there too?
Let's see. The question about not having enough time to get the vaccine, requiring three doses over 6 months. Kimmy took that question as fast as I read it. No? She's good?
She indicated it was going to be answered by.
Okay. So yes, we know that there are many of the, a few immunizations that require a stepped series over a period of 2 to 3 months. We would like to know that you have started that series. We will ask for proof of that, and we'll work with you one-on-one if you haven't quite been able to complete it. Let's see. Anything else coming up about immunizations? I'm looking through some of the others. Have there been cases of COVID-19 right now at Cal Poly? That answer is no. We have not had any reported cases of any of our community members. And when I say community members, I mean faculty, staff, or students. So the numbers in San Luis Obispo County in general have been very low. There are 142 cases today. We are a relatively small county by comparison to some of the other urban areas. So there are close to 300,000 residents in the entire county. And I'll just compare to the city of Oakland, because that's a city near and dear to my heart. That's a city of about 400,000 people. So if you think about how spread out we are, our numbers have been low, but we as a county have been responding and taking all the precautions and just keeping a watchful eye on it. Someone's asking about general safety measures around campus regards to security. You know, we have a very dedicated police force that monitor the safety of our students. They're here for us. They're here for our students. There are also other ways that security, we have a transport service, or, you know, after hours we can connect. I think, Lauren, you might be able to speak to this a little bit easier since I haven't used it, but the buddy system always works. I'm not sure if that's specific enough, or I think we're good. 3 minutes, okay. Let's see. So if that hasn't answered that person's question about general safety measures, I'll let someone answer it. Very good. How do you know that we were vaccinated? How do we let you know that we were vaccinated? Is there a place in our portal for that, or a department to contact? Alex, is Alex around? She's in the chat room.
Yeah.
The quick answer is yes, there's a way to do that and a way for that information to be sent to us. I'm going to let Alex take that one. All right. We're good. 2 minutes? Okay. What type of public safety drills training take place for students? Awesome question. For students that are living on campus, speaking from personal experience, I lived on campus the first year I worked here. There are many safety drills specific to fire. So there are fire drills. The residence halls are evacuated, sometimes very inconvenient times of the night. But they do drill those for students to make sure that they know the evacuation routes, meeting locations, what to do when you get to that meeting location. We also have a Department of Emergency Management, which has been helping us through the COVID-19 response. We have an ability to pop up an emergency operations center for any sorts of natural disasters. We worked really closely with PG&E during the power shutoffs to prevent the wildfires. So our campus has a really robust response plan for disasters, emergencies, and other safety concerns. 1 minute.
I'd also like to jump in quickly and talk about the training that SAFER does for students. There is an online training in regards to alcohol, cannabis, and other drugs use on campus, as well as sexual violence prevention and bystander intervention that occurs prior to enrolling in classes. And we also have training for all of the resident advisors and all students coming on campus in regards to bystander intervention in the realm of public safety.
Thanks, Jennifer. All right.
There's a, do you do
Yeah.
school shooter lockdown drills?
I don't,
Oh, please. We can answer that in the chat.
all right, I think we're good.
Yeah.
Good job, team. Thanks all. Can't wait to see you.